Innovation in healthcare space is our lifeblood.
I think technology convergence is here to stay. It's a reality. I think it has tremendous potential to improve the outcome for patients.
I think we need to kind of sit back and look at what's essential to providing care, good quality, safe care, and what's just fluff.
It's not a justifiable or rational marketplace at all, and there's no risk sharing.
We are going to invent our way out of our healthcare problem. American ingenuity will carry the day.
The conference occurred on May 11th at Stanford GSB at the new Knight Management Center.
The title of the conference was Fostering Innovation in Healthcare, and it really brought together folks who were stakeholders from different parts of the healthcare community.
The conference was attended by a really diverse population. We had faculty, we had practitioners, we had students, and what I enjoyed the most is it really crossed over many of the disciplines at Stanford University.
The purpose was to start a dialogue between our students in the MBA program, students across the street that are interested in healthcare innovation, and entrepreneurs in Silicon Valley. To have a dialogue and to start a dialogue about how the changing landscape in healthcare is affecting innovators. This year, one of the topics that came up over and over throughout the day was the issue of health reform.
I'm going to really start off with some slides to put into context the impact that we're seeing of healthcare reform, not only here in the US, but on a global basis, on the delivery of technologies.
Healthcare reform brings us great promise. It already has clear pathway to expanding coverage to more people. What it doesn't have to date is a pathway to sustainability. And that sustainability is only going to come by your ability to manage costs.
So if we really focus on product solutions that can help reduce the cost, which will get remunerated in the new business models emerging, I think that's a good bet to place.
The convergence of multiple technologies from different sectors to address healthcare issues was also a recurring topic.
Another driver for what's going on in the healthcare system, particularly in medical devices, but across, is the integration of really four major categories of technologies. The integration of IT into devices, pharmaceuticals into devices, IT into pharmaceuticals, and the growing focus on whether we can, through genetics, understand the predisposition for a patient to respond to therapy, whether that be a pharmacologic therapy or device-based therapy.
I fundamentally believe there's a Google to be built within healthcare who can really understand this data coming from multi-source, whether it's genomics, devices, clinical data, and then really turn that into something meaningful.
While Convergence is enabling a lot of innovative new solutions, it also presents challenges to entrepreneurs, especially against the backdrop of healthcare reform.
With the integration of more complex technologies, we're seeing overall more risk, more time to develop these technologies, and by virtue of that, more money being required to bring them through to commercial reality. What that's driving is less predictability, lower returns, and less investment. And this is the challenge, I think, overall we see within the healthcare environment.
As many of the speakers pointed out, it's not an easy time to be an innovator, but there was a lot of enthusiasm at the summit about healthcare as an important and an exciting area to be working.
I would submit to you that right here, right now, there's never been a better moment to be a healthcare innovator in American history. Why is this? It's because two mega trends, which I've been waiting for personally since I was a small child, are finally locking in epic form and scale. The first is massive incentive change, which has begun, which we'll talk about. And the second is information liberación, which is also locking in multiple exciting respects. Collectively, new incentives and information liberación equal rocket fuel for innovation, rocket fuel for entrepreneurs.
There was a great deal of interest in what is going on in the US around incentive changes, reimbursement reform, and how these new policies will impact innovation.
The thing the Affordable Care Act does, which I believe is the single most important feature of the whole law, is it actually authorizes, directs, and funds Medicare, the biggest payer in the country, to shift how it pays from pay for volume to pay for value, to pay for health, to pay for quality. Unless this happens, innovations that improve quality and efficiency are never going to take hold. But if you actually morph how you pay from pay for volume to pay for health and value, I predict, and we're all beginning to see this, that you'll see some remarkable momentum toward efficiency, and quality. Our role is to simply be a catalyst and a supporter, to do everything we can to fan the flames of these trends and to help weaponize American entrepreneurs and innovators to transform healthcare at a speed and with a ferocity that I think will stun the world.
I think people realize that changes in reimbursement will create new opportunities for innovation in the long run. But of course, innovators will still have to figure out how to be successful in the short run as well.
The speed of a startup is not the speed of government. I mean, they'll never match each other.
My caveat is this is all timing. How long will it take for this to settle down? And I think it's more years rather than months, which makes it very difficult as an entrepreneur in terms of your business model. What do you want to build your company for?
Another topic that received significant attention was the growing importance of other countries around the world in healthcare innovation.
There are actually more mobile phones in the world than shoes, and people have access to phones easier than clean water. Countries in Africa and India are building their healthcare systems from the ground up without ever going to have the number of physicians that we have here, all these technologies. So it's an interesting place to see what's going on, and something that we want to capitalize on. So I think the thesis of high volume, low margin devices and solutions versus what we see here in the US is a real opportunity.
I think developing countries have a huge advantage relative to the overdeveloped world, where I think often our institutional barriers and proprietary barriers are much higher to trying to create an integrated system.
Despite the fact that the U.S. is a leader in many aspects of healthcare today, we have many lessons to learn from our partners overseas, and the competitive landscape in the healthcare industry is shifting dramatically.
Instead of finding simple solutions, we seem to find this most complicated solution to protect ourselves against malpractice liability. And what I've seen in traveling around the world is that sometimes the simplest solutions are the best.
When 80% of the market, global market, exists outside the United States and the challenges of coming through our regulatory approval process here is made more complex, companies are choosing to not enter the U.S., which does create some challenges for our overall healthcare system.
For next year, we definitely want to continue this dialogue. There are a lot that we're going to learn over the next 12 months about how the changing healthcare environment with the new healthcare law, but also with emerging markets, is going to influence innovation. And we want to explore in more depth how these changes are affecting innovators in Silicon Valley and beyond.
We're in the middle of historic change in healthcare, and things are going to be a little bit clearer next year in terms of major directions of the Affordability Act, how the industry, how the practitioners are responding to that. So I think it's going to start to get clearer, and next year's conference will be a good time for us to take another look at the way things are moving.